my name is Chad Lefteris, and I'm the CEO at UCI Health, and I wanted to take a few moments to share with you some exciting news and some exciting happenings across the UCI Health enterprise. In just a moment, we're going to go really deep into the new Irvine-Newport Medical Center complex, but before we do that, I want to step back and let you know a little bit more about UCI Health and what we've been up to. So next slide, please. So you may not know that we are home to the region's only academic medical center. Our total operating revenue is north of $1.4 billion. We employ almost 5,000 total FTEs here in Orange County. And we do that through various sites throughout the county, as well as over 400 licensed beds here at our main Orange campus. You can see some of the other statistics here. I won't read all those to you, but pretty staggering when you think about over 50,000 emergency department visits alone and over 18,000 surgeries between our inpatient and outpatient settings. And then there's a list of the onlys. And I like to say, again, as the only academic medical center that affords us a unique position within the county and the region. And I'll just point out that we're the only level 1 trauma center throughout the county and home to the only NCI designated comprehensive cancer center, just to name a few. Next slide, please. So when you think about our main campus in orange, and you see that denoted here with the big yellow dot, that is certainly our hub and will continue to be that. And then you also see scattered throughout the county are other outpatient sites, in addition to the new Irvine-Newport campus location, also noted with the yellow dot near the bottom. And we'll talk more about that in just a minute. But on the right, you can see how we've grown to over 20 sites throughout Orange County. You can see some of them listed there. We've continued to expand our primary care physician network around these sites to feed into these locations. And we have additional sites planned. So as the county continues to grow, we want to make sure that we are set up to grow with the county and make access even easier for our patients and families and their loved ones to get the amazing care that UCI Health can offer very close to where you may live. So you'll see 3 more sites planned over the next year, and then another couple of sites planned in 2022 as we look to expand where the need is greatest. Next slide, please. So a lot of things have been happening throughout the pandemic over the last almost year now. And I'm really pleased to say that in addition to that, and our teams have done an amazing amount of work and tremendous effort and really led the way throughout the county around COVID and the entire pandemic. But also we have launched really incredible new programs or expanded existing programs all in the middle of a pandemic. And that's pretty unique to think about. We launched a brand new bone marrow transplant program for cancer patients. Before that, patients were having to leave out of county to go get this level of care, very unique level of care. We launched our Digestive Health Institute, again, just a few months ago in the middle of a pandemic, leveraging really the expanded program offerings that we have under the broader GI and other hybrid locations where we can now have it all in a single location and really, again, make it easier for patients to access. On the neurosciences front, we have a fantastic new chair of neurology who's bringing world-class movement disorder expertise into an already excellent program. And we continue to recruit additional faculty there to expand access both to neurology and neurosurgery. And then we started a brand new program, again, the only one in Orange County. We started this back in the early days of the pandemic, in the early spring and summer, for a left ventricular assist device, or known as LVAD program. So again, those patients were having to leave the county prior to that. And a county with over 3.3 million people, we need to be able to offer that for the citizens in this county. So really excited to be able to say that we've expanded these programs even in what's been happening with the pandemic, all happening at the same time. So really, really proud of our teams that have come together to do that. Next slide, please. So as we reshape sort of what we're doing here at UCI Health, you can see our mission hasn't changed: to discover, teach, and heal. I love the simple and the powerful statement in that. That does not change. Our vision, we've refined a little bit over the last year, and it's to be the best place to give and get care. In other words, we want to be the place that you want to work and practice medicine, and also the place that you and your loved ones want to come to for care. The best place to do that. And we do that by leveraging all of our leaders, our frontline coworkers, and everyone in between, and then utilizing these 3 pillars at the bottom to really be our filter for everything we do. So we're going to talk about how we're going to improve health of our community. We're going to talk about how we increase the value that we bring to our community at large and to the payers and others. And then how do we do that? Well, we do that by transforming the way in which we deliver care in a different way than we can even maybe think about today and what it would look like in the future. Next slide, please. So you're going to see a quick video of the brand new site, and then we'll move on beyond that.
The future of healthcare is here. With approval to build UCI Medical Center Irvine-Newport, UCI Health will bring the unparalleled expertise and quality care of Orange County's only academic health system to coastal and South County residents. Our state-of-the-art acute care hospital, alongside 2 outpatient care centers, will offer a 24-hour emergency room, urgent care services, easier access to leading-edge cancer treatments, and clinical trials from our NCI designated Comprehensive Cancer Center, and exceptional inpatient and outpatient care by our world-renowned experts in every discipline, from digestive disease to neurosciences and orthopedic surgery and cancer care. At UCI Health, we will stop at nothing to build a healthier Orange County.
So the news was just released just a few weeks ago that the University of California Board of Regents approved our new complex at Irvine and Newport. And you can see this is just an example of some of the headlines that came out at that time. Many, many more were out there, because it's not every day that you get the final approval to invest over $1.2 billion in a new inpatient and outpatient, really, I would say campus, because it is multiple buildings that we're constructing right on the edge of the main campus in Irvine. Next slide, please. So as you can see, we'll start to share a few images now so that you can see this is really happening in real time. We're designing and we're refining. Actually had another good discussion with our designers just today on this topic. So this continues to evolve, but you can see on the screen in the bottom right-hand side, the first building, you can just see the edge of there, is known as the Center for Advanced Care. It will be the first to go into construction and the first to open late 2022, early 23, and that will be all outpatient. And we'll share a little bit more about some of the details that will be happening in that building. And then next is the Comprehensive Cancer and Ambulatory Care Center that will open 9 or 10 months later in the fall of 23. And then finally, the hospital with a full-blown emergency department will open in the fall of 25. And those 2 buildings there, the Ambulatory Care Center and Cancer Center and the hospital, are connected below grade, actually at the surgery level. So we're really taking advantage of the amazing site and those amazing views that we'll have for our patients and loved ones, and really allow for folks to be able to step outside easily, take a phone call, take a respite break, whatever may be needed, and then easily get back to whether it be on any of the buildings or the inpatient side as well. So the site is setting up quite nicely as we continue to refine the design. Next slide, please. So just to orient you to where this is going to be located, it is right on the edge of the main campus at UCI. And you can see on the left-hand side of your screen, there's the yellow block with the black outline, and that is the acreage that's dedicated for this new campus. And we've zoomed into that on the right-hand side. So that's really right at the intersection of Jamboree and Birch Street, Jamboree Road and Birch Street. And then you go up just a little bit further and you're at Campus Drive. So this is really going to create an amazing gateway into the main campus, really at Campus Drive and Jamboree. And we like to think that this, again, over $1.2 billion of investment is going to really shine. We know that Jamboree is a busy road, and we will make sure that it's easy for folks to access off of that busy road. So we're working very closely with our colleagues in the planning department, as well as the city and others, to make sure that this is really easily accessible, whether you're an emergency vehicle or a patient loved one coming into the site. Next slide, please. So I get asked a lot, why are you doing this? And really these 4 drivers are the primary reasons why we're doing this. You've already heard me talk about improving access. And that's something we will constantly strive to do. So we know that the Irvine zip codes and those zip codes to the south continue to grow with population density. And so we know there's a need, and we need to be in this location to be able to reach those patients easier. Make it easier so they don't have to drive all the way up to Orange in traffic or fight other traffic post and COVID to get to a facility and to get to routine visits. So we're bringing that expertise down to this location. Also, some would say we should have had a hospital on the main campus of UCI maybe 50 or 60 years ago when the campus was first being planned. And for lots of different reasons, we started up here in Orange. And so now we get a chance to fulfill this dream of being more connected to the main campus. And you can imagine what that means to support research and teaching, of course, also the clinical care but just being proximate to and surrounded by the main campus is a huge driver for this location and for these services. As I mentioned, the growth that's happening again in Irvine, but also around the Irvine area is something that we know that if we're not there to meet those demands, we also know that patients are traveling outside of the service area, even outside of the county, as I mentioned earlier, for care that we can provide. So we're bringing really those experts that are known of UCI Health, backed by UCI, to this location to make it easier for everyone to access. And then finally, even prior to COVID, prior to the pandemic, we are virtually full every day here at our Orange facility. We have close to 420 beds, and we are virtually full every day. And so that makes it difficult, right? When we want to continue to grow volume and bring additional patients to a higher level of care, and we have to say no, or we have to wait because we're so full. So these additional inpatient beds and outpatient capacity will also allow us to expand our offerings here in Orange, because this is what I like to call an and strategy. We continue to grow here in Orange while we also create this new site down in the Irvine-Newport location. Next slide, please. So just to zoom in a little bit more, so these are the details about what's happening within the spaces. I mentioned the first building, which is the Center for Advanced Care. Again, it will open first. It's about 165,000 square feet of outpatient space. And again, these renderings are hot off the press, and we continue to design them. So stay tuned for the final iterations. But you can see at the bottom, the key services that we're going to be offering within there. Our Center for Children's Health will be there, and we're fortunate to have some Prop 3 funding from the Children's Hospital Bond to help support that, which is very unique. We'll certainly have primary and specialty care and urgent care for after hours and weekends coverage as well. And you can see the key services of neurosciences, orthopedics and spine, and Digestive Health Institute will all be located within this first building, again, opening late 22, early 23. And then you move to the hospital and the ambulatory care center and cancer center. And we're talking about a 144 bed inpatient facility with a full-blown emergency department. We're also talking about 8 ORs there on the inpatient side of the hospital, but another 10 ORs at that lowest level, as you can see in the screen there, really on the ambulatory care side. So a total of 18 operating rooms, which is a huge operation and certainly needed for the growing areas around Irvine. We also know that those same specialties that we've mentioned, many of them will be present here in these two buildings and certainly in the inpatient side as well. So cancer, neurosciences, digestive health, orthopedics, and spine. And I mentioned the start of the brand new bone marrow transplant program, for example. Those patients will also be able to be seen in the inpatient, a new bed tower here as well. So a huge culmination of a lot of these key service lines. Again, data tells us that folks are leaving the county or leaving their service area, traveling too far for these items that they desire care in, and we can bring those experts closer from the main Orange campus to this location. Next slide, please. And then we like to think about how we're designing the entire site, not just the buildings, but the entire site from start to finish. And we're working with various design and architect teams to really boil that down to make it very, I think, understandable as they go away and do their design work in their teams and in their studios. And so we work together with our physician and clinician leaders, as well as the executive team, to really boil down imagery, right, that we could share with the designers and really spoke to what we wanted to get out of this site. And through various exercises, we boiled it down to these 4 really key elements. So we want the spaces to feel natural. And by that, I mean, this site is really tremendous. As I mentioned, the views from this site and the topography sets up really nicely. So how we're going to integrate the building into the landscape and really blur inside and out together so that you can easily step outside, as I mentioned, take a break, get back in very easily, but take advantage of the amazing weather we have to offer in Southern California and really blur inside and out together. Simple design means, to me, timeless. So it doesn't look like it's out of date tomorrow. And so simplicity in design is something that we're working on with the design teams, but also simplicity in wayfinding and, again, access. So we might think it's simple, but from our patients' feedback, maybe that's not true. So we're integrating lots of patient feedback into the design, into the wayfinding, and ultimately it needs to feel inviting. So big healthcare buildings, this is hundreds of thousands of square feet, over 600,000 square feet when it's all built out. That's pretty intimidating. And so how do we soften that at the pedestrian scale and the vehicular scale for it to feel very inviting when you arrive into not just the building, but the actual campus. From the moment you turn in from Jamboree Road and you start to experience it, we want to make it very easy and inviting and warm at the same time. And then finally, it's a brand new, amazing complex. Again, over $1.2 billion will be invested in the design and construction. So we want it to feel and look cutting edge, but to go back to simplicity and timelessness, it needs to continue to be simple at the same time. So that's our challenge to the design team, and they love a good challenge. Look forward to seeing all of it come together here soon. Next slide, please. The other question I get the most is, well, what have you learned during the pandemic that may change the way you're going to design future healthcare spaces? And I could probably spend many, many more minutes and maybe an hour on just that topic alone, but just I'll hit really 4 key elements. One is we've learned, and as you all have probably heard, the need for more ICU beds during a pandemic such as what we've experienced. So we're creating this new bed tower to be flexible so that the beds could easily convert to an ICU level bed, really just by changing the staffing. That's called universal care and patient bed setup. And so we design the spaces so it doesn't really matter. The patient room is set up to be an ICU level room, even though we may not use it for that except during extreme situations or during something like a pandemic. But we plan now to do that so that we don't have to run around and create spaces differently during a surge. As I mentioned, we're going to have amazing opportunities to blur inside and out. And so even today here at our Orange campus, we have utilized our wonderful outdoor spaces for outpatients to wait. And then we text or call them to come get them and walk them to their appointment. So they're not sitting in a historically old, maybe cramped or smaller waiting room that doesn't allow for physical distancing. So we're certainly designing our waiting rooms differently to allow for physical distancing, but also allowing to take advantage of outdoor spaces, which is the best way to really have physical distancing. And then planning now for outdoor staging areas around this new campus. Here in Orange, we have a mobile field hospital sitting in our front parking lot, right at the front door almost. Well, we didn't really plan for that because who would have thought that you would need to do that? But the learnings by having that and having to erect that as a part of this pandemic are making us think differently about what we can do around this the buildings at this new site to plan for whatever may be needed from a staging area for, let's say, for the emergency department or for inpatient beds like a mobile field hospital. So planning now based on the learnings that we've gone through here in Orange. And then finally, we've all probably by now experienced some form of virtual health or a telehealth visit that really took off during the early days of this pandemic. And I don't think that's going to go away. But I will say that the changes that will occur and need to occur within your traditional physician office or clinic environment to allow for those seamless telehealth visits is something that we're designing into our spaces today. So that you don't need to take up an exam room to do a telehealth visit, but you also don't want to be standing at the main, let's say, workstation at a nurse's station or something to be doing a telehealth visit. So you do need private areas so you can do that in a very seamless way for our patients. So those are some of the things that we've learned, and we'll continue to refine this list as we go deeper and deeper into design, really as we finalize the last little bits of design over the next few months. Next slide, please. And then finally, I just want to wrap up maybe where we started, which is around, we're very excited from a UCI Health macro perspective that these projects were just recently approved by the University of California Board of Regents. You can see that check mark there. That was at the January Regents meeting. And again, as I mentioned, you can see the timing for the buildings that will phase into the site over time, with the first being the Center for Advanced Care, and then culminating with the new inpatient hospital. It does take longer to design, longer to build, longer to activate and get licensure and regulatory sign off for an inpatient hospital. That's why you see that last. But meanwhile, we'll have the 2 outpatient buildings up and running well in advance of the late fall of 2025 when the hospital actually opens. So it's my pleasure to be with you today. Thank you for taking the time to learn a little bit more about UCI Health, but also about this tremendous new asset at the new UCI Irvine-Newport location. Thank you very, very much. Take care.